Sleep apnea. Sleep apnea is a common disorder in which you have one or more pauses in breathing or shallow breaths while you sleep. Breathing pauses can last from a few seconds to minutes. They may occur 30 times or more an hour. Typically, normal breathing then starts again, sometimes with a loud snort or choking sound. Sleep apnea is a broad term which basically means breathing stoppage during sleep. This term has been used loosely, and every troubled sleep is now tagged as sleep apnea. There are several causes for troubled sleep. One of them is associated with breathing. You can have sleep issues if you have a poor digestive system, constipation, mental or psychological issues, and so on. Whatever the reason is, the cause has to be fixed for a permanent cure. Why is good sleep so important? The body recovers during sleep and it heals. Poor sleep has been attributed to weak immune system, which causes increased illness, lack of energy, hypertension, diabetes, obesity, poor memory, and so on. Sleep apnea can be caused by a person's physical structure or medical conditions. These include obesity, large tonsils, endocrine disorders, neuromuscular disorders, heart or kidney failure, certain genetic syndromes, and premature birth. Following are the main causes of poor sleep. Obesity is a common cause of sleep apnea in adults. People with this condition have increased fat deposits in their necks that can block the upper airway. Large tonsils may contribute to sleep apnea, because they narrow the upper airway. Endocrine disorders. Neuromuscular conditions. Heart or kidney failure. Genetic syndromes. Premature birth. What are the effects of sleep apnea? If sleep apnea left untreated, then sleep apnea can result in a growing number of health problems, including high blood pressure, stroke, heart failure, irregular heartbeats, and heart attacks, diabetes, depression, worsening of ADHD. In addition, untreated sleep apnea may be responsible for poor performance in everyday activities, such as at work and school, motor vehicle crashes, and academic underachievement in children and adolescents. What is obstructive sleep apnea? Obstructive sleep apnea, or OSA, also called obstructive sleep apnea syndrome, occurs when there are repeated episodes of complete or partial blockage of the upper airway during sleep. During a sleep apnea episode, the diaphragm and chest muscles work harder to open the obstructed airway and pull air into the lungs. Breathing usually resumes with a loud gasp, snort, or body jerk. These episodes can interfere with sound sleep. They can also reduce the flow of oxygen to vital organs and cause irregular heart rhythms. What is central sleep apnea? In central sleep apnea, breathing is disrupted regularly during sleep because of the way the brain functions. It is not that you cannot breathe, which is true in obstructive sleep apnea. Rather, you do not try to breathe at all. The brain does not tell your muscles to breathe. This type of sleep apnea is usually associated with serious illness, especially an illness in which the lower brainstem, which controls breathing, is affected. In infants, central sleep apnea produces pauses in breathing that can last 20 seconds. Conditions that may be associated with central sleep apnea include the following: congestive heart failure, hypothyroid disease, kidney failure, neurological diseases such as Parkinson's disease, Alzheimer's disease, and amyotrophic lateral sclerosis, Damage to the brain stem caused by encephalitis, stroke, injury, or other factors. What are the symptoms of central sleep apnea? The main symptom of central sleep apnea is temporary stoppages of breathing while asleep. Although snoring is a very strong symptom of obstructive sleep apnea, snoring is usually not found with central sleep apnea. Symptoms may also include being very tired during the day, waking up often during the night, going to the bathroom often during the night, having headaches in the early morning, poor memory and difficulty concentrating, mood problems. How is central sleep apnea diagnosed? If you have any of these symptoms of central sleep apnea, or if a family member or bed partner notices that you stop breathing while sleeping, you should talk to your doctor or healthcare provider. Obstructive sleep apnea is a common form of sleep apnea disorder across the world. Sleep disorders are highly prevailing in majority of regions globally and is affecting the population health severely. Troublesome ill effects of the disorder are important cause for increase in rate of adoption for sleep apnea diagnostic systems. Sleep apnea is a chronic disorder that can be bifurcated in two different types: obstructive sleep apnea and central sleep apnea. Among the two, obstructive sleep apnea is a common form of sleep apnea. Obesity and rapidly rising aging population play a crucial role in the growth of the global sleep apnea diagnostic system market. How do I cure sleep apnea? Curing sleep apnea is difficult and there are only a few things that can do this. If you suspect you may have sleep apnea, the first thing to do is see your doctor. Once the doctor confirms that you suffer from sleep apnea, there are multiple treatment options which might differ from one patient to other. Some of them are positive airway pressure devices. Positive airway pressure machines, used with a variety of breathing masks, are the most widely used treatment for moderate and severe sleep apnea. The mask, worn snugly over the nose, or sometimes nose and mouth, during sleep, supplies pressurized air that flows continuously or intermittently into the sleeper's throat. The increased air pressure prevents the sleeper's airway from collapsing. The pressurized air is supplied through a flexible tube from one of several types of machines. CPAP, continuous positive airway pressure; BiPAP, bilevel positive airway pressure; VPAP, variable positive airway pressure, and so on. Studies of the effect of PAP therapy show that people with sleep apnea who consistently use their machines feel better and, as a result of the reduction of apnea and hypopnea episodes during sleep, encounter fewer complications of the disease. There's more information about PAP therapy here. Although PAP devices are not used to treat snoring alone, they do eliminate snoring in addition to treating obstructive sleep apnea. Oral appliances. Oral appliances for the treatment of sleep apnea continue to increase in popularity as awareness grows amongst the public that oral appliances are an effective first-line treatment for many sleep apnea sufferers. These appliances are worn in the mouth, just like a sports mouth guard or an orthodontic appliance. While you sleep, oral appliances hold the lower jaw forward just enough to keep the airway open and prevent the tongue and muscles in the upper airway from collapsing and blocking the airway. The American Academy of Sleep Medicine has approved oral appliance therapy as a first-line treatment for patients diagnosed with mild to moderate obstructive sleep apnea. They also recommends oral appliances for patients with severe obstructive sleep apnea, who are unable to tolerate or cannot wear CPAP devices. Another option for people with severe obstructive sleep apnea is combination therapy, wearing CPAP and an oral appliance together to help reduce the pressure on a CPAP machine, making it more comfortable to use. Advantages of oral appliance therapy. Oral appliance therapy is an effective, non-invasive treatment that fits easily into your lifestyle. Patients like oral appliance therapy because it is comfortable, easy to wear, portable, convenient for travel, easy to care for. Custom-made oral appliance. There are a few over-the-counter appliances you can purchase at drugstores or even online. Remember that these oral appliances are not approved for sleep apnea. When not fitted properly, over-the-counter appliances can cause unwanted side effects, such as jaw problems or tooth movement, or can even have the opposite effect and inadvertently worsen sleep apnea. If you snore or believe you have sleep apnea, contact your physician to help schedule a sleep study to determine if you do have obstructive sleep apnea. If it's determined that an oral appliance is an option for you, it should be fitted by a dentist specially trained in dental sleep medicine. Upper airway stimulation therapy. Some people with obstructive sleep apnea are unable to use continuous positive airway pressure, CPAP, therapy. The most commonly prescribed OSA treatment, despite best efforts. Now there's a new, clinically proven therapy for some people with moderate to severe obstructive sleep apnea who are unable to use CPAP. This is a therapy that works inside your body, and with your natural breathing process, to treat moderate to severe sleep apnea. This therapy might be right for you if you have been diagnosed with obstructive sleep apnea. You can't use or don't get relief from CPAP. The system consists of 3 components: a small generator, a breathing sensor lead, and a stimulation lead, all controlled by the small handheld Inspire Sleep remote. Simply turn the therapy on at night before bed, and off in the morning when you wake up. When activated, Inspire Therapy continuously monitors your breathing patterns during sleep and delivers mild stimulation to key airway muscles, which keeps the airway open. Doctor will also evaluate your airway anatomy and overall health status to determine if Inspire Therapy is right for you. Weight loss. About 70% of people with obstructive sleep apnea are overweight or obese. Their healthcare professionals usually encourage them to lose weight. Surprisingly, there have been few formal studies of how effectively weight loss leads to lesser, lighter snoring and diminished incidence of apnea and hypopnea during sleep. Despite this, anecdotally practitioners report striking improvements in both OSA and snoring among patients who lose weight. In some situations, a physician may wish to prescribe weight loss medications to an overweight or obese patient with OSA. Nasal decongestant. Nasal decongestants are more likely to be effective in cases of snoring or mild sleep apnea. In some cases, surgery is an effective way to improve airflow through the nose. Positional therapy. Some people snore or have sleep apnea only when sleeping on their back. Such people can eliminate or reduce airway blockage simply by learning to sleep on their side. There are also a couple of companies that make products designed to discourage supine sleeping. Positional therapy generally works only in mild cases of obstructive sleep apnea. In more severe cases, the airway collapses no matter what position the patient assumes. Surgery is often effective in treating snoring. Surgery in adults. it is less effective in treating obstructive sleep apnea. The challenge that confronts the surgeon is determining what part of the upper airway is causing the obstruction to airflow. There are many possible sites, and conventional sleep testing does not identify the area the surgeon should modify. If the surgeon does not treat that site in the airway, or if there are multiple sites of obstruction, it is unlikely that the sleep apnea will diminish to a degree that eliminates the need for other treatment. Given the several sites where airway obstruction may exist, there are several types of operations currently used to treat sleep apnea. The most common is uvulopalato-pharyngoplasty. The success rate of this operation is about 50%. Nonetheless, most authorities recommend routine reassessment for sleep apnea after surgery. Surgery in children. Most children with snoring or sleep apnea have enlarged tonsils, or adenoids, or both. In 75% of those cases, surgical removal of these tissues cures sleep breathing problems. The American Academy of Pediatrics has endorsed removal of the tonsils and adenoids as the initial treatment of choice for sleep breathing problems in children. There is more information: children's sleep apnea and its treatment here. Other. Abstinence from alcohol before bedtime is an important part of treating sleep apnea. In one study, several persons who received cardiac pacemakers were reported to have shown an improvement in their sleep apnea. No major organizations have endorsed this type of treatment, however. Further studies are underway. Alternative healing methods are also in use. Or other wind instruments may help in managing obstructive sleep apnea. In Brazil, acupuncture researchers who are physicians report positive results in treating obstructive sleep apnea with acupuncture. Avoid alcohol, it causes frequent nighttime awakenings and makes the upper airway breathing muscles relax. Quit smoking, cigarette smoking worsens swelling in the upper airway, making apnea and snoring worse. Some patients with mild sleep apnea or heavy snoring have fewer breathing problems when they are lying on their sides instead of their backs. Snoring, and certain details of snoring, can be a valuable early warning alarm that sleep apnea is present. The presence of sleep apnea presents special challenges to the administration of anesthesia and pain medications that may affect respiration or relax muscles. Since most people who have sleep apnea don't know it, the anesthesiologist or pain clinician is well advised to screen the patient for obstructive sleep apnea before proceeding. Should it be determined there is a likelihood that obstructive sleep apnea is present, the next move is to order a sleep study to make sure, or, at a minimum, to take the precautionary steps that should be taken with a patient whose sleep apnea has been diagnosed. Why is it important to get treatment for sleep apnea? Seeking treatment for sleep apnea will enable you to prevent most of the chronic disorders linked with sleep apnea. Recent studies on sleep apnea have revealed that sleep apnea cures help to enhance the memory, minimize cardiac ailments, heart failure, and minimize exhaustion. Furthermore, researches have indicated that utilizing CPAP is as efficient as taking medication for blood pressure. If sleep apnea is left untreated, it can enhance the danger of sudden demise.